On this day, we have come together to celebrate the accomplishments of our friends, families, loved ones, and colleagues. Hello, I'm Clinton Cruz, Director of the EVMS Master of Surgical Assisting Program, and I welcome you to the Class of 2021 Award and White Coat Ceremony. Well, here we are. It feels like August 20th, 2019 was only a few days ago, but here you are, budding new professionals filled with promise of potential yet discovered and leaders for a new generation of surgical assistants in the making. Let me confirm that all capstone papers have been read and reviewed. Your cases have been entered and approved. Your case reports and PowerPoints have been marked as received, and your final grades have been entered. I officially deem that you have met the program requirements of completion. Congratulations.
Hello and welcome. I'm Dr. Richard Homan, President, Provost, and Dean at Eastern Virginia Medical School. And I want to welcome you today to the Surgical Assisting graduation ceremony. I wish we could do this in person. I'm delighted to be here virtually, and I'm usually welcoming families and friends in the audience and seeing the smiles on their faces as they are so proud of their graduates. And so I can see them virtually today as you celebrate with your graduates and the families of all of our graduates in the Surgical Assisting program. I want to say that they've done an extraordinary job. This pandemic has created enormous challenges for all of our students at EVMS. And our Masters in Surgical Assisting program is no different. You've surmounted many different challenges, working virtually, identifying ways to be able to get more experience in the operating room, being patient, looking at ways to be able to look at simulation to improve your skills, and you've succeeded. You've done enormous work, and you've succeeded to get to the point where you're now going to be graduating in the next few days, and I want to congratulate you all. I do want to say that our program is special. We have a master's in surgical assisting. It's the only in the United States, and it's the highest quality, in my view, of any program nationally. And you've exceeded all of our expectations. And that's evident from the extraordinary performance on all the certification examinations that have occurred over the years. We've had a 100% pass rate on all the surgical assisting certification exams. And I am absolutely confident that you will follow that path. I want you to thank your families for getting you here, and also acknowledge the extraordinarily skilled and dedicated faculty that brought you along the way. We're very proud of you, and we want to welcome you as alumni in the coming years. So on behalf of all of our faculty and staff, I want to congratulate you, congratulate your families on this enormous achievement. And at this time, I'd like to introduce Dr. Donald Combs, Vice President and Dean of the School of Health Professions, for his comments. Thank you.
Well, welcome. I appreciate all of the effort and perseverance and patience that this class of 2021 surgical assistant students has shown during the past 18 months. It's been a difficult time. It's been difficult for students. It's been difficult for faculty and staff, and of course for the community. But having said that, you're here because you have completed the requirements to become a surgical assistant. And we're delighted with that. I want to add my remarks of welcome to those of Dr. Homan, and know that we wish you very well. In the few moments that we have before us, I want to make just a couple of observations that I hope you'll find helpful. This ceremony, white coat ceremony, marks an important transition from that of a student to a practicing professional. And I think it's very important in the era of COVID to think about what we may have learned from this whole experience. And I think we've learned an awful lot. But one of the things that we have learned is that when someone says this is a novel experience, that means it's new. That means we don't know much about it. It means that we have to spend a lot of time trying to gather evidence and make a compelling case. And when new evidence becomes available, if we have to change our prior guidance, we do that. When we started with the COVID experience almost 18 months ago, we really didn't know exactly how it was going to play out. We knew it was going to be bad. We had no idea that 30 to 40% of the people with the infection would be asymptomatic and thus spreading the disease unknowingly. We had no idea that the variety of symptoms, from respiratory difficulties to loss of taste and loss of smell and discoloration of toes, would be so variable. We had no idea it would last this long. We had no idea that it would, in fact, run into the political quagmire of the ongoing and permanent debate between individual freedom and collective security. And we've argued that increasingly over the last year. My point being that we learned a lot in this experience. And I think one of the most important things that we learned is that we have to keep learning all the time. We have to let the evidence guide us. We have to do the very best we can. And if we make a wrong decision, we have to acknowledge that and move on. The other general point that I want to make is that each of you has demonstrated exceptional competence as a student and will no doubt do that as a practicing professional. However, I think it's also important to realize that it doesn't really matter how smart you are as an individual. You simply cannot know everything that you need to know to do the best for your patients. It also doesn't matter how skillful you are as an individual. You do not have the skill set to do everything that is necessary to provide the best care to your patients by yourself. So the implications of those two statements are that you need to consciously surround yourself with a network of professionals who think differently than you do, who look at different types of evidence than you do, who bring different skill sets to the problem, because it takes the collective effort to make a real and lasting impact on patients in the most positive way. So my almost parting advice to you is that you spend a lot of time thinking about and developing relationships with other professionals, and don't develop relationships only with people who think like you think. That doesn't broaden your field of vision. The value of a network is in its breadth and its diversity. So in conclusion, for the graduating class of surgical assistants in 2021, I want to reemphasize one point in particular, and that is that a lot of people have helped you get to this point, and you need to recognize that, and you need to acknowledge that. You need to say thank you every opportunity that you have. As my mother used to tell me, if the last thing that people remember about you is that you said thank you, that's not a bad thing. Thank you.
Since 1964, Norfolk, Virginia has been the training ground for individuals who have sought to assist surgeons in the enhancement of the outcomes of the surgical patient. In 1979, a group of surgical assistants and surgeons came together to develop professional standards and a job description and the National Certification Examination for Surgical Assistants. The SA program was formally adopted by EVMS in 1981. The program was initially offered as a certificate program of completion, in 2007 as a graduate certificate, and in 2013, the first master's in surgical assisting degrees were awarded. The first 50 years of this profession has been cemented. The next 50 years provides many opportunities, and it is my hope that the individuals in this class are the architects and the champions of its future. Our training program is 22 months long, 10 months of classwork and skills development, followed by 12 months of clinical training. The program is required to track and report our students' clinical training experiences. Our program accreditation body requires that surgical assisting students complete 140 cases in specific surgical areas to meet the minimum requirements for entry into the profession. Those requirements are 40 cases in general surgery, 100 cases in a variety of surgical specialties. For our students, the program requires students to complete 60 cases in a variety of different surgical specialties and 50 cases in a particular specialty as a concentration. If you're counting, that equals 150 cases required, 10 more than the minimum national standards. I can report that this year's class participated in 976 cases in general surgery, 5,542 cases across 13 surgical specialties. 40% of students graduating completed concentrations in 2 or more surgical specialties, averaging a total of 167 cases. They assisted on 6,518 cases during their surgical training experience. They served as a surgical assistant for the case at 63% of the time during their clinical training. I would like to recognize the following students for their achievement during the clinical training phase. For surgical concentrations, Deandra Brown, Sarah Brown, Tyson Curry, Ashley Murray, Elise Olar. At this time, I'd like to recognize special accomplishments of students for the Anatomy Award, Sarah Brown. Communications Award, Matt Russell, Tyson Curry, Chris Snell, and Deandra Brown. As the director, it's fortunate that I have the opportunity to make special awards. So this time, I'd like to recognize, I'm going to offer 9 Directors Awards to recognize outstanding clinical accomplishments. The first set of Directors Awards go to individuals that completed 5 concentrations. Those individuals are Tyson Curry, Ashley Murray, and Austin Sack. The next set of accomplishments will be for students who have completed 6 concentrations. Those individuals are Sarah Brown and John Cahill. The next set of awards is for the individual that completed 7 concentrations, Megan Rhodes. The next individual I'd like to recognize completed 8 concentrations, Deandra Brown. And the final award goes to the student who completed 7 concentrations, 5 specialties, and first assist on 468 cases. That student is Elise Orloff.
Hello, my name is John Kao. I'm the student government representative for the Master of Surgical Assisting class of 2021. First, to my classmates, I'd like to congratulate all of you for everything we've done to get to this point. I would also like to thank our friends and family who are celebrating our achievement at a distance and for supporting us through this program. Every year, the graduating surgical assistant class gets the chance to recognize a faculty member for their outstanding service. We've had many teachers, instructors, and professors through the program, and each of them have played a great role in our training. But I would like to take this moment on behalf of the class of 2021 to recognize Professor Karen Owen for all of her work with our suturing and principles labs, building the foundations of our surgical conscience, and coordinating our rotation schedules between 36 different sites, just to name a portion of what she does. She has continued to be one of our greatest advocates and has our sincere thanks.
Hello, my name is Megan Danaher, and I am a part of the Masters of Surgical Assisting class of 2021. Now, our curriculum is broken up into a didactic year and a clinical rotation year. Our professors have provided us with the knowledge and skills now going to be applied during our clinical year. It is my honor and privilege to recognize the Best Preceptor Award to Mr. Scott Sprouse. Scott, you possess an inherent ability to create a welcoming learning environment. You provide a seat at the table in developing the future of surgical assisting. Your team aids in our first bit of experience, not only at the surgical field, but in our patient experience. You amplify our passion and eagerness to learn. This meaningful rotation builds our resume so that companies are more inclined to hire new graduates because they have comfort in knowing we are fit to fill the role. The best self-reflection stems from sharing our day with our family. I know I am not alone in saying that our preceptors are the protagonists in our stories. This shines light on how you have impacted our education and that our interactions with you have imprinted on our ability to be the best surgical assistants we can be. I hope you make it to 10,000 births, and I look forward to that baby that will be your 10,000th case.
In the medical profession, traditionally, students wear short white coats during their training. Upon completion of their formal training, they don long white coats. Today's white coat ceremony will officially signify the transition from trainee to trained professional.
Introducing EVMS Masters of Surgical Assistant Program graduating class of 2021. Deandra Brown. Deandra has specialties in obstetrics and gynecology, as well as plastics and reconstructive surgery. Sarah Brown. Sarah has specialties in orthopedic surgery and general surgery. John Cayo. John has a specialty in plastics and reconstructive surgery. Tyson Curry. Tyson has specialties in orthopedic surgery as well as plastics and reconstructive surgery. Megan Danaher. Megan has a specialty in plastics and reconstructive surgery. David Lee. David has a specialty in obstetrics and gynecology. Ashley Murray. Ashley has specialties in general surgery as well as cardiac surgery. Parisa Rafi. Parisa has a specialty in orthopedic surgery. Megan Rhodes. Megan has a specialty in orthopedic surgery. Austin Sack. Austin has a specialty in orthopedic surgery. Jason Shoddy. Jason has a specialty in orthopedic surgery. Chris Snell. Chris has a specialty in orthopedic surgery. Kristen Wexel. Kristen has a specialty in plastics and reconstructive surgery. Congratulations to the EVMS Masters of Surgical Assisting Program Class of 2021. You did it.
At this time, I'd like to welcome Ashley Murray and Deandra Brown to the podium to offer the student address.
My name is Ashley Murray, and I am one of the class representatives for the EVMS Master of Surgical Assisting Class of 2021. Today, we are here to celebrate our monumental accomplishment of becoming the next group of surgical assistants to graduate from EVMS. Our goal moving forward should be to continue to grow our skills, our knowledge, and our profession. I hope that you are all very proud of your accomplishments thus far, and I hope that you don't stop here. I hope that you go out into the world and continue to make our school and our profession proud. Continue to educate those who aren't aware of our profession, and always lend a helping hand to those that cross our paths. Always remember the famous quote, "See one, do one, teach one." Just know the sky is the limit, and we are all destined for great things. Congratulations, Class of 2021.
Greetings, Class of 2021. It has been an honor to serve as one of your class representatives. I can't picture a better group to have undergone the adversity the year has brought us. With that said, the resiliency, teamwork, and communication, both in and out of the classroom, will empower us to become excellent surgical assistants. We entered the program with different backgrounds and experience. However, our intentions were the same. We love the art of surgery, its precision, and ability to challenge us on a day-to-day basis. We have worked so hard in pursuing a career in which our passion aligns. My hope is that we become mentors, strong leaders in the operating room, and an advocate for our profession. Teach every student who walks into your OR someday. Don't forget about the friendships, surgical assistants, nurses, surgical techs, physicians, faculty, and preceptors that made an impact on your journey here at EVMS. As we embark on a new and exciting career, let's find comfort in knowing we will leave this program equipped with every tool necessary for success. Congratulations and best wishes, Class of 2021.
Before I close this ceremony, I'd like to offer a wish to the graduates. Graduation holds the promise of good things yet to be. Wishing you warm memories of efforts you have seen through, of lessons learned and honors earned, of cherished dreams come true, and wishing you some bright new dreams of sights you've yet to see, of joys you will know, of ways you'll grow, of all you've yet to be. Congratulations. This officially concludes the awards ceremony for the class of 2021.